Hello and welcome back to the How You Move series presented by HSS. I'm Scott Seiberling, Clinical Manager at HSS Paramus Rehabilitation, where we are currently on site. Today I'm joined by three panelists, two HSS Paramus physicians, along with a local star athlete and hockey player. Let's begin by having our panelists introduce themselves.
Hi, I'm Dr. David Wong. I'm a primary care sports medicine physician here at HSS Paramus. I'm one of our anchor physicians, which means I'm in the office here 5 days a week.
Hi, I'm Devin Kelly. I play for Bergen Catholic, and I play for the New Jersey Hitmen 16U Premier Team.
Hi, I'm Shiraz Qureshi. I'm one of the spine surgeons here at HSS Paramus, as well as in the city at our main campus.
So tell us what brought you to see Dr. Wong.
I was playing lacrosse, and it was my first practice, and I threw a pass, and I very painfully hurt my back, and my mom told me that I needed to see a doctor, and her work recommended Dr. Wong.
So when I first saw Devin, his initial injury with lacrosse was probably about 4 or 5 months earlier. He had kind of transitioned through to the hockey season, and had I think done some physical therapy on his own, and thought it was getting a little better. And then I think when hockey season really kicked into gear, I think it started coming back and bothering you again. We pursued an MRI, and that's where we saw the stress fracture. It was an interesting fracture because typically we see those down in the lower lumbar region. There's 5 lumbar vertebrae. We typically see it at the L4, L5 level, but Devin's was actually up more at L2, and so that's the benefit of working here at HSS Paramus. We have multiple different experts in many different fields, and working closely with Dr. Qureshi, I was able to talk with him, and because it was in such an odd location.
Given that the location of this injury was particularly in an unusual area, it sort of drew a lot of red flags that we wanted to really be careful and cautious in terms of treatment here. So one of the first things that we had discussed was the importance of really shutting him down from activities, which is never easy in a guy as active as Devin is, and we had to be sort of have that conversation with him about how shutting him down now for 6 weeks was going to allow for him to really have the long-term return to sports and activities for the rest of his life potentially, and be able to avoid surgery. So we put him in a brace, and then at that point, we shut him down from activities. We took him out at the 6-week time period. He had been pain-free for 6 weeks, and at that point is when we referred him over to really sport-specific rehab with you, Scott, to really get him back fully into his activities, including hockey.
And what sort of movement vulnerabilities do hockey players possess that might predispose them to this sort of injury?
Yeah, I mean, hockey players and just athletes in general, with these, lower back stress fractures, we often see, 2 main categories. One is, often people that have very tight hamstrings, and with those tight hamstrings, that's going to put more stress and load up through the back. The other people, we often see it in our young athletes that are hypermobile, and they have a lot of excess motion in their spine, and that can then put a lot of extra stress through that. And so, and you can probably speak this with your therapy as well, often we treat one area, we don't just address that area. So it's not just strengthening the back, we also have to look at strengthening the core, the legs, it's what we call the kinetic chain. Everything's connected, so if one part's not working, it's going to affect another part. So, and I know you're great at that here with rehab, where it's not, if I say, okay, he needs back rehab, you're not just focusing on his back, you're looking at his whole kinetic chain. What can we address, what can we improve that will really help take some pressure off that area.
Dr. Qureshi, when do these sort of injuries become a situation that requires surgery?
Yeah, so the good news is that most young patients who have this type of a problem will get better without surgery. And as a surgeon, when I see a patient like Devin, the first thing I think about is, can I help this patient with surgery? But just as important is trying to figure out, if we can't help them with surgery, or if they're not yet a candidate for surgery, what should we do non-surgically that's going to be able to get them back to full activity?
Yeah, Devin, I think that must have been very difficult for you to stay still and really avoid all activities and just go home after school instead of going to practice and all that.
Yeah, I mean, obviously it was a bad injury, but I got a lot of rest, and I was able to focus on school when I was hurt. So there was plus and minus of it, but it was just not uncomfortable. Like everywhere you go, it's that race, you know what I mean? It's just not something you want on you, but yeah. I mean, it made me feel better. Obviously, I'm back playing sports now, and I'm glad I listened to the doctors, not myself.
I think one of the biggest advantages of the center and having you be a Bergen County resident here, I would think would be convenience for you rather than going into the city for treatment and care. The other thing is because the three of us worked so closely together, and knowing that you had high-level goals during the rehab, I could quite easily run over to Dr. Qureshi or Dr. Wong and say, I saw Devin today, we did this, he responded like this. Is that normal for this sort of injury? And we could push you accordingly without setting you back at all.
At HSS, we sort of take care of more of these problems than anywhere in the world. And being able to use that knowledge that we get from taking care of these problems hundreds of times a year to a community setting where otherwise that kind of treatment may not be available, where we have the sports specialist, the spine specialist, the rehab specialist under one roof, can be really advantageous to the community here. And I think, you're a perfect example of that. I'm so happy that you're back fully playing hockey.
Thank you.
Yeah.
Thank you, Dr. Wong, Devin, star hockey player from Glen Rock, and Dr. Qureshi for joining us and sharing your expertise and knowledge and your journey back to recovery and back to the ice in this episode of How You Move. Tune in next time for more in-depth analysis on injury prevention and recovery in sports medicine.